ascorbate uptake or ascorbate availability. We want to know how much is needed now, because it varies over time. We can use ascorbate well and on an individualized basis, teaching people the tool and then letting them use the tool for themselves at home. We can even do this for ourselves, and it's much more effective when the client knows that we're actually doing this ourselves or our loved ones are as well. Ascorbate Szent-Györgyi, who isolated ascorbate from Hungarian paprika, considered it a life-giving molecule. This is his 1932 article, the first page in a reprint. He is the one who showed, and others have confirmed, that ascorbate concentrates 30-fold over plasma, that it's the most prevalent complex molecule in metabolically active cells, and that adequate amounts replaced most, little more than half, of sugar cravings. So if you know anyone that has hypoglycemia symptoms, ask them to calibrate their ascorbate, and a little more than half the time, the hypoglycemia will go away, because the body is hungry for ascorbate that other species can make out of glucose, and the clinical manifestation is the hypoglycemic symptoms, not because blood sugar is low, but because ascorbate is low. And when you give the ascorbate as needed, the hypoglycemic symptoms go away. What about acute musculoskeletal pain? Here we want to mobilize the dendritic cells. The dendritic cells are your first responder cells. They're the cells responsible for primary defense and repair. And here we recommend 2 flavonoid-flavonol capsules every 15 minutes until you're comfortable for 1 hour. Then 2 per hour while awake for 2 days, 4 twice daily maintenance for 3 months to consolidate the improvement. This rapid use of safe polyphenols, safe flavonoids and flavonols, has, for example, taken patients who were in asthmatic status. In one case, a woman had called the EMTs to take her to the hospital. Then she called her doctor, who suggested this. By the time the EMTs came, she had taken 2 doses and was better enough that they watched her for 45 minutes while she took another 3 doses, and then she was fine and sent the EMTs home. Another case, I got called 2 or 3 weeks ago on Thursday because a woman was sitting on the edge of her bed trying to decide if she should go to the hospital because of her asthma, and would I talk to her? This is someone I had never spoken to before. I said, no, I think she should go to the hospital, and when they take care of her, then I'll be happy to talk to her. I'm a prevention doctor, not a treatment doctor. She says, would you please talk to her? She won't go anywhere. In 5 minutes, the woman convinced me that she knew what was going on, and at the end she said, and no doctor ever listens to me, but if any doctor ever did, I would be just fine. I said, may I paraphrase back what you just said? She says, yes. And I just repeated back what she had said, and she said, you're listening to me. I can trust you. That night, having followed this approach, she went out dancing. And because she is the First Lady of Samoa, married to the Governor of Samoa, I got a whole commendation from the First Lady, or from the Governor of Samoa. So sometimes you get unexpected benefits. Sometimes you get unexpected hassles, but sometimes you get unexpected benefits. So if we want to activate these dendritic first-line repair cells, we might take 4 of these flavonoid-flavonol tabsules with each meal and before bed until we're comfortable for a week, and then 4 twice a day for maintenance. This is for chronic musculoskeletal pain, whereas the other recommendation was for acute musculoskeletal pain. So in the acute situation, we want to get a lot of these polyphenols in to activate and keep those dendritic cells moving. When my son was in either middle school or beginning middle school, he was playing baseball, and it was widely known that when my son got injured, he took this flavonoid-flavonol combination and ascorbate. A friend of his, a teammate friend of his, was hit by a bat. This happens a lot at that age. Sometimes they hit themselves, sometimes someone else hits them. But the child was hit by a bat, goes off to the side to kind of regroup, and the swelling came up in his eye so fast that you could see the eye close because of the swelling. The child asked me if he could have some of what Sky takes. Now, I'm not this child's father, so it's probably unwise for me to treat the child on the spot. Fortunately, the parent of the child was there. The child did take this item and got back into the game in the next inning because the swelling came down that fast. When you see those cases happen, you're totally convinced that activating the dendritic cells, the first-line repair cells, is a really good thing to do, and that all too often they just are depleted in their energetics. They're intoxicated because of toxic metals. They are acidotic and lacking in antioxidants, and they just don't work